Diabetes, both type 1 and type 2 collectively, is already a huge problem in this country, affecting millions of Americans, but it's poised, if we don't do something, to become, part of the pun, a gigantic problem in this country as people's waistlines are getting bigger, especially. Well, the men and women at Hartford Healthcare are offering a questionnaire for all of you to figure out whether or not you're at risk. And joining me more this morning to talk about that is the Chief of Endocrinology at Hartford Hospital, Dr. Robert Oberstein, and the Vice President of Hartford Healthcare's Community Health and Engagement, Mr. Greg Jones, who is no stranger to the show. Good to see you again, Mr. Jones. And we will get to you in a second, so I apologize for not doing it. But, Doctor, thank you for joining us today. Today is Diabetes Alert Day. Can you talk about that and the need for it?
Sure. American Diabetes Association has set up the fourth Tuesday of March as an alert day to do just what we're doing now, to get the word out that we are wanting people to take a look at themselves and figure out, are you at risk for diabetes? Yeah. Are your family members at risk? And go get screened, go get tested. It's one of many things that people should be screened and tested for, but particularly today, that's our focus.
How many people are at risk for even just type 2 diabetes?
Well, we have currently 30 million people in this country who have diabetes, so it's a big number.
Yeah.
1/4 don't even know they have it, and there's another 80 million people who have diabetes, who have pre-diabetes, who are at risk.
Yeah.
So they're borderline for it. They don't have normal sugar, they don't have diabetes, but they're at risk of becoming diabetic.
And that means if we don't do something in about 20 years, 1 out of 3 Americans could have at least type 2 diabetes. What are some of the symptoms people need to look out for diabetes? We'll get to pre-diabetes in a second.
So the first big concern is that many people who have diabetes have no symptoms at all.
Yeah.
So that's a big concern. But when it gets more advanced, you can develop blurred vision, thirst, extra urination. You can develop tingling in your feet. There's these other symptoms that come on, but that's well into it, sometimes years after they've been dealing with high sugars.
That's the biggest thing. Again, he said it so quickly. I want you to get it. Pre-diabetes really has no symptoms. I'm imagining that's where the questionnaire comes in.
Correct. Correct. So with the questionnaire, we can identify, do you have a risk? Should you go get tested? Okay.
And my understanding is the questionnaire is fairly simple. It's not going to take you a lot of time, but it's also part of a much larger effort to try to get the word out. That's where you and the fine people at Hartford Healthcare come in, Mr. Jones. Tell me about what you're trying to do.
What we're trying to do is really educate people. One of the big social determinants of health is really information and education. So if we can get the population at least a little bit more informed, to be more knowledgeable, as Dr. Oberstein said, that really a third of people really don't even know. So this is a way for them to try to self-test, self-educate, I should say, self-quiz, to inform themselves about what risk that they may be at, and then seek counsel from their primary care physician. So our goal is to reach out to various community centers. We have this form that we have been circulating to various community centers and outreach, and using programs like yours to really get to the public about how important it is to be informed and knowledgeable. We like to say, be informed and then be responsible.
What else, real quickly, are you guys doing as far as getting out to those community centers?
So we visit them. We like to take folks like Dr. Oberstein when we can to give a self-talk, a talk with the population. But really it's figuring out those community centers and those community locations, and primarily a lot of the underserved communities where we really can have a partnership. We go back to them on a one-on-one basis so we can continue to talk about them and have this education with them.
I also imagine some of the poorer socioeconomic areas could be at greater risk for diabetes because access to good nutrition isn't that easy to always get, too.
I agree, and I think Dr. Oberstein would also indicate that there's certain demographics that are more subject to diabetes than others. So we understand that, and we try to reach those targeted areas with this information to make it more impactful.
Okay, real quick, for either one of you, how can people access the questionnaire?
So questionnaire, there'll be a link that you'll have on your website that can link in. Also through the American Diabetes Association, diabetes.org. They can find it there as well.
Yeah, I believe it's a 7-question questionnaire. Am I right? There
Very quick and simple.
Yeah, and that's all you need to know. It's a lot of common sense stuff, but it is crucially important. Gentlemen, thank you so much for your time, Doctor.
Mr.
Jones, good to see you again.
Always good.
Yes, great to have you back.